Rick Gates is Walgreens Senior Vice President of Pharmacy and Healthcare. Rick, thanks for being here.
It's great to be with you.
I guess that would be Dwayne Reed here in the big city, Walgreens all across the country. I'm trying to envision, everybody's in line for vaccines and total chaos. And where do we wait? And what do we do? Are you prepared for this?
Yeah, we are prepared for this. And first of all, thank you for having me on today. And I can't tell you what a momentous day it was today to really get there with all the planning that's been happening with Operation Warp Speed, CDC, and the states to get out there and get the first vaccines in the arms of the most vulnerable populations of America. It just makes me proud. And Shep, I just want to let you know that the stories we're hearing back on this are just amazing. And people clapping when people get vaccines, and just the camaraderie around the partnership that we have with long-term care facilities. It's going to be fantastic as we roll this out. To answer your other question, it won't be chaos. I think what you're going to see is we're going to be very thoughtful on how we're going to schedule appointments, how we're going to work with the communities that we're in, the states that we're in on priority populations to make sure it is not long lines out pharmacies' doors, and make sure that people have safe and convenient and efficient ways that they get vaccines.
Yeah, I'm just sort of thinking it through, and I'm thinking, all right, I go to Walgreens and afterwards I have to wait 15 or 20 minutes and I have to be distanced and I have to wear my mask and there has to be room for people to come out and do whatever they're doing to pick up. It's a lot of organization.
It is, but vaccines are what we do very consistently, and monitoring patients after a vaccine is a very common thing that we do. Think about flu shots, Shingrix, or other types of vaccines that are out there. The safety protocol that we've given to our pharmacists on training up front, how to look for any sort of allergic reactions, how to make sure that they're monitoring patients post-vaccine. It's all part of the normal process. And as long as we're scheduling appointments, ensuring that we follow up with all the appropriate questions up front, it will still be a process that will be seamless for us.
Yeah, once we get to general population, it has to work like this. There'll be some people in to get dose number 1, and then there'll be some people who are coming back for 3 weeks later, and I guess they'll have a card. And if someone's not in the right category or they're not eligible yet, who in the Walgreens jacket says, nah, you can't do that? I mean, you wonder how you say no chaos. I can't imagine zero chaos because I live in New York. I'm anticipating chaos every moment.
Yeah, I wouldn't say chaos, but I would say that, there will be some bumps along the way. But what I do expect is that we'll be working very closely with states on their prioritization, making sure that we can identify the right people for vaccine.
But what I'm curious about, though, is who's the bad cop, Because if I'm up there and I'm 25 and I have no comorbidities, but we still working on old people and people with diabetes, and I come running up there going, come on, who is the bad cop who says, no, not you?
Yeah, that's why it's all going to be pre-scheduled. It's not going to be walk-up vaccines that you're going to see. And I think we'll be working to ensure that the right populations get into screening and scheduling of appointments so that they know in advance when they're eligible and they can come in and get vaccines. So it's not going to be a walk-up type solution. It's going to be something that we have to work with states very closely with CDC as well.
This is kind of new to me. So much like I need a reservation for dinner at a good restaurant, I need a reservation to get my vaccine, and if I don't have a reservation, I don't get a vaccine. Is that pretty much how it works?
That's how we should expect it to work, but it's all going to be digitally led, and obviously we want to make sure that there's not going to be any inconvenience or confusion in the process as well. But scheduling appointments also allows us to do those safety protocols that we talked about, giving time to have somebody sit there and be monitored after the fact as well. It's all part of the process that we have to make sure that we adhere to.
These are interesting details to me. You said digitally led. Does that mean I would use, say, the Walgreens pharmacy app to schedule, or in other cases, maybe the CVS app? That's how I would schedule my vaccine through the Walgreens app?
Yeah, there's multiple ways that we will be able to schedule, but obviously going through our apps or our digital Walgreens.com, we will have ways for people to go in to verify that they're eligible for vaccines, and then obviously schedule appointments at that point in time. And even equally important, they can schedule their follow-up vaccine as well, because we need to make sure that we get that second dose in at the time that we give them their first vaccine.
I've learned a lot here. I've learned I'm going to need a reservation, and I have to do it on time. That means my old man, it's his 93rd birthday today. He has diabetes. He has high blood pressure, but he's kicking it and ready to go 20 more years. He'll get his pretty soon. I mean, he's like an A2.
Yeah, so I'd say that the sooner that you get it, obviously, then we'll have multiple ways to obviously not just give the first vaccine, but schedule follow-up. So you can see it as two different populations. Long-term care facilities, we obviously will go out with pre-planned clinics for the second and third to ensure we get second dose. For the population,
Right.
we'll have all sorts of reminders, phone calls if we need to make sure that the Americans know that they need to get that second dose and the proper timing for that dose as well.
I'm loving this. Dad's been in the house since March. He'll be thrilled to sign up on the Walgreens app. Great to see you. All the best. We're pulling for you. Thank you.
Thank you.
Shepard Smith here. Thanks for watching CNBC on YouTube.